Hi guys, my name is Josh. I'm a health and wellness expert on behalf of ToHealth. Thank you so much for joining us this morning, taking time out of your morning to join us. So what we're going to be doing today is talking about heart health. We'll be discussing factors that can affect our heart health, and we'll also be talking about some changes in behavior that maybe we can adopt to help improve our heart health. Okay, so I'm just going to show us the outline of what we're going to speak about today. So first we'll talk about your cardiovascular system. We'll talk about the risk factors and what their stats look like. Okay, then we'll talk about the indicators, so how we can gauge your heart health. We'll look at things like your blood pressure, your blood cholesterol levels, your BMI, etc. Okay, and finally we'll cover ways in which we can improve our heart health, and that can be in forms of our lifestyle changes, the foods that we eat, the physical activity we do. Also, if we get to a certain point where we are starting to experience these symptoms, severity of these symptoms, the kind of medication and medical treatment that the GP may actually prescribe to you, and what kind of forms that looks in. Okay, so let's talk about heart health. So your cardiovascular system is made up from the heart, the arteries, your veins, and capillaries. So the latter three being better known as your blood vessels. So it's your heart and your blood vessels. Okay, so I'm just going to try and get a highlight here just so I can explain this. So this is what happens. So blood comes in to your heart through the vena cava. So this is deoxygenated blood in blue. Okay, so it comes in through the atrium here and it comes down into the ventricle. Okay, and then you have your heartbeat. Boom. Okay, and that's called your systole. Okay, that's a horrible arrow, sorry. But that's called your systole. Okay, so once that happens, so the deoxygenated blood goes towards your lungs. So it goes from your pulmonary arteries here and here. Okay, once it goes to your lungs, it gets oxygenated. It's a process called gaseous exchange. So once that oxygenated blood now comes back to the heart, so it comes in through here, your pulmonary veins, through the atrium down into the ventricle, and then from the ventricle, boom, systole happens. Okay, and then it gets distributed from the aorta. Oh, that's the wrong way. And that just gets spread around to all parts of the body. That's where your circulatory system takes over. Okay, so your arteries carry your blood away from the heart and veins carry your blood towards the heart. Okay, so yeah, your circulatory system then provides your blood to all of the cells in your body. It removes carbon dioxide and removes waste and provides oxygen and nutrients to the whole of your body. Okay, let me just put an eraser just to get rid of these horrible arrows. But what's not mentioned on here is your coronary arteries. So your coronary arteries, you have your right and left coronary arteries, which will be around about here and here. I'm not sure if you can see that because there is a lot of red, but it will be around about here and here. So your coronary arteries supply blood to the heart, and that just helps with the heart function of doing those heartbeats. Okay, and the process of the circulatory system and your heartbeats just never stop. When you're waking, when you're asleep, it just never stops. So that's your cardiovascular system. So what are the risk factors? So now, unfortunately, there are risk factors that can cause our cardiovascular system damage. Okay, some of these factors we can't help, unfortunately, and that is your genetics, your age, your gender. We just can't help that. Okay, but there are things that we can help and can factor in, such as your nutrition. It could be physical activity. If we stop smoking and if we can limit alcohol, these are factors actually that can help our cardiovascular system start to function nice and limit that damage. Okay, so what do the stats say? So dietary risk factors are associated with 53% of cardiovascular disease deaths. Hypertension, so hypertension meaning high blood pressure, accounts for 13% of cardiovascular disease deaths. Tobacco accounting for 9%. I'm just going to stop there. So some of these stats can actually be shocking, and what the stats don't mention is the knock-on effect some of our behaviors have. So for example, smoking will increase our risk for hypertension. And I'll talk about that more at the back end of the presentation when we're talking more about smoking and alcohol. And also alcohol increases our risk of hypertension. Okay, so if we're consistently smoking and drinking, you can see that we'll increase our risk for cardiovascular disease just by hypertension, right? And if we're now smoking and drinking in copious amounts and also having foods that are processed foods, that are takeaway, that are foods that are high in salt content, what happens is our risk for cardiovascular disease again raises. Okay, just get rid of these. Constantly bad arrows, I apologize. So the stats more about this. So more than 900,000 people in the UK are living with heart failure. 7.6 million people are living with heart or circulatory disease in the UK. The most common type of heart disease is coronary heart disease. Coronary heart disease is when the arteries that we spoke of before become narrow, yeah, and they become built up with fatty material within the walls. So they become narrow. It starts to prevent circulation. Okay, so coronary heart disease is the most common cause of heart attack and the biggest killer worldwide in 2019. Have a look at this. It's estimated that 90% of cardiovascular disease can be preventable. So we're going to talk about the factors in which we can help our heart health, because it is estimated that 90% of cardiovascular disease can be preventable. So we can reduce those risks. So how do we gauge heart health? So there are some vital checks we can do to catch signs of cardiovascular disease. Many people may be showing early signs and symptoms. So I'm just going to do a small segue here. So many of us have early signs or symptoms, but I don't think it's ignorance. I think we just persevere. I had a workshop 2 days ago actually, where I was talking about mental well-being and stress awareness, and we're talking about how the symptoms of stress, what the symptoms of stress are. And I had about 5 or 6 symptoms on there, and I was saying, okay, so you're experiencing these symptoms, would you still go to work? And people were saying yes. And I'm saying, guys, these are symptoms of stress. Like, we need to address this, you know. And it's kind of similar here, where we may be having certain symptoms, but we're just not that we don't know it's there, because we do know it's there, but we just kind of persevere. Oh, we need to do work. Oh, we need to do X, Y, Z. So if we leave these signs and symptoms unchecked, it can lead to greater detriment to our health. So health is wealth. Please, 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 if you are seeing these symptoms, let's try to address them. Yeah. So yeah, many people are undiagnosed but still living with these diseases. The good news is that with the following health assessments, we can get a clearer picture of where your health currently stands. Okay, so let's have a look at these health assessments. So your first one is blood pressure. So this is how much stress your circulatory system is under. Yeah. So with the blood pressure machine, how it works is you have a cuff that you would put on the upper left side of your arm. We always go left arm because it's close to the heart, okay? And the air will fill the cuff. Okay, so you have the machine, and then you have the cuff that you put on your arm, and then air will pressure. Okay, so what happens then is it cuts off the brachial artery. So your brachial artery starts at your shoulder and goes down into your elbow, the fold of your elbow, and then it cuts off into different branches. Okay, and so yeah, what happens is the air releases, it gets nice and tight on there, and then it will slowly start to release that pressure to gauge where your blood pressure is. Okay, so that's how it kind of works. So your systolic meaning, so the first number you usually see with those readings is the maximum pressure during that heartbeat contraction, and your diastolic means the pressure in between heartbeats. Okay, so anywhere between, or anywhere below, sorry, 140/90, so systolic being 140 and 90 being diastolic, is considered to be a normal reading. Above that, especially if we're going to 160/100, we're in the hypertension category, and we really need to go and book an appointment to the GP. Okay, so hypertension, high blood pressure, can lead to heart attack, stroke, and heart failure. So just a little bit more about this. So 1 in 4 adults in the UK have high blood pressure, although they may not realize it. And this can be caused by poor nutrition, inactivity, so sedentary lifestyle, excess caffeine intake, smoking, and alcohol. These are all factors which boost that high blood pressure upwards. Okay. So one of the other checks we do is your blood cholesterol. Okay, so cholesterol is a waxy-like substance. It helps with cells. It helps with the cells within the body function. Okay, and what it also does, it helps with the formation of bile, vitamin D, and it also helps with steroid hormones like progesterone and testosterone. So it's a precursor to help with the formation of those. But what we do check is your total cholesterol levels. Yeah, we check your HDL. So this is called your high density lipoproteins, your good cholesterol. Okay, and what that does is it takes fat from the peripheral regions and brings them in towards the liver to be used. Okay, the bad cholesterol does the opposite. You see, it doesn't do that. And then we also check your total cholesterol and HDL ratio. So how does this check work? So usually this check is a finger prick. Okay, it can be done venous draw as well, venipuncture, so we get blood from the vein, but it's usually a finger prick. Okay, and we take that blood sample and pop it into that strip. We pop it into a blood reading machine, and then that will tell us what your total cholesterol is, what the HDLs are, what your ratio is, and then we can work out what the bad cholesterol is. Okay, so high cholesterol can lead to heart problems and stroke. Okay, and high cholesterol is usually mainly caused from eating processed foods, sedentary lifestyle as well, and smoking and drinking alcohol also causes high cholesterol. It can also be genetic. It could also run in the family. Okay, I'm just going to do a little small example of what high cholesterol kind of looks like. So, and mind the drawing. Drawing on this is actually quite difficult. So I want you to imagine this is your artery. Okay, so it's similar to like a road, how this works. So you know how you have roads, they kind of look like this, right? And so what happens is if we have nice clear arteries, it's like driving on a nice clear road. Okay, what happens when we start to eat these processed foods is, so like in the road, how you have cars that park on the side like that, and then driving through this actually becomes a bit challenging, especially if you have other cars in the way, right? It's sort of like how this works with your arteries. So you get these plaques on the sides here and here, and blood's trying to flow through that. Okay, so the blood flow is now constricted, it's restricted, and your heart has to work harder. Okay, and this is what happens when we have these processed foods. We get these blockages in our arteries. Okay, and it just restricts our blood flow. I wish I could draw a lot better. I apologize for the horrible drawings today, but we persevere, we persevere. Okay, and so we're going to move on to other measurements we can look at to determine, so to get a better picture of our heart health. So we can look at your BMI. This is an introductory measurement, okay, and this is your height divided by your weight squared, and having a high BMI can push your resting heart rate higher. Okay, we can look at your waist hip ratio. Okay, so this is a measurement of your waist first and then hip circumference afterwards. Okay, if more body fat is located around the waist area as opposed to your hips, there's a higher chance of heart disease and also of type 2 diabetes. And then we look at your body fat percentage. So we have these scales called Tanita scales, and these are able to show us your BMI, but also your body fat and also your subcutaneous and visceral fat. So your subcutaneous fat is the fat that sits underneath the skin but on top of the muscle. Okay, and then your visceral fat is in that abdominal cavity. It surrounds the internal organs. Okay, and excess body fat can increase the risks of heart and circulatory disease as well. Okay. So then talking about all these measurements we do and kind of gauge how your current health is, the question then becomes, what can we do to help heart? Well, there are such factors like lifestyle changes, nutrition, physical activity, which all play a part in improving our heart health. Okay. And depending on the individual and the circumstance, uh, doctors may actually prescribe medication to also help with your heart health. Okay. So, what lifestyle changes can we make? Well, first, let's talk about alcohol. Sorry to be the fun police, guys. But when we drink alcohol, what happens is our blood vessels constrict. So like this, it gets smaller. So it gets constricted and narrow, and blood circulation gets very, very difficult flowing through. Okay. And your heart works harder to push that blood around the body because of how restricted those arteries become when we drink alcohol. When we drink copious amounts of alcohol, everything I just mentioned can increase more, and this will increase the risk of stroke and heart attack. Okay, so the recommended units for men and women per week is 14 units. Okay, so just have a little look at the unit intake the next time you're having a little drink, just to find out where you are with your alcohol intake. And smoking, so smoking causes the cells that line the blood vessels. So if this is your blood vessels, it's the cells that line the blood vessels. Yeah, I'm not sure if you can see that, but those cells become inflamed, right? And then what happens is, again, those blood vessels become narrow, swollen. Because they're swollen and inflamed, they become narrow, and this causes circulation to become difficult. Okay, so what it also does, smoking does, is it causes plaque to become built up in the arteries, blockages to occur, and even clots to happen within the blood vessels. Okay, so all of these things contribute towards coronary heart disease. So do you remember when I was talking about the coronary arteries, the right and left coronary arteries? This can lead towards coronary heart disease. It can also lead towards heart attack and stroke. Okay, so if we stop smoking, after 1 year, your risk of a heart attack is half that of a non-smoker. Okay, okay. Let's talk about nutrition. So, mono unsaturated fat and polyunsaturated fats can provide your body with omega-3s. They are amazing. Okay, we're talking in the subject of heart health here, so I'm not going to go off on a tangent because it does help with the brain, but we're talking about heart health here. And so omega-3s can help with decreasing your risk for cardiovascular disease. What does that look like though? So it looks like dark leafy green vegetables, almonds, cashews, avocado, salmon. Okay, we got all sorts of seeds here, chia seeds, flax seeds. So if we're having this, we can reduce our risk for cardiovascular disease. But it also comes in the form of foods, that the form of cooking the food, right? So if we are frying the foods, then we're actually promoting trans fats to happen, especially if we're frying with like butter and things like this. We're promoting trans fats, which is the one that's going to actually increase the risk of cardiovascular disease. So let's try alternatives like baking and grilling or steaming foods. The best example I could use is cod, the fish cod. So if you was to have that baked as opposed to having that, filled with batter and fried, because when we're baking or grilling that cod, it's going to be much healthier than when we have it battered and fried. Okay, I'm going to use that example I used earlier just to illustrate what happens then. So do you remember I was talking about the road? Yeah, and then so this is your road, and then you have blockages which look like traffic. Okay, and some of those blockages can even be just a car stood right there and you're gonna have to wait until that car moves. Okay, and so your arteries are looking like this. Now, when we start having a diet that has monounsaturated fat and polyunsaturated fat, the good thing is these plaques can start to clear. And now we can fully drive down that road, or our blood can fully go down our arteries without any of these blockages. Okay, so try to increase these monounsaturated and polyunsaturated fats where you can, and also having your 5 a day also helps with this. It helps lower your risk for heart disease and stroke. Okay. Next is physical activity. So being active can reduce the risk of heart attack and circulatory disease by as much as 35%. Okay, so activity can come in many different forms, whether it's gardening, whether it's, you know, walking, tidying. It will all contribute towards more activity. Excuse me. So aiming for around 150 minutes of moderate exercise a week will lower your risk of cardiovascular disease. But what does that look like? So moderate exercise. So what I mean by this is increasing your heart rate to anywhere between 50 to 70%. Okay. So your heart is beating faster, but you should still be able to maintain a conversation. Okay. When we get past 70%, your heart's going to be beating faster, but we won't be able to talk. We won't be able to have that conversation. Okay. So one of the best ways, especially if you don't have time, you're busy, you've got work, you've got projects, you know, you've got the kids running around, and your heart rate's going up anyway because you're trying to chase the kids to calm them down, right? But if you don't have time, what can you do? Well, the simple one I tell people to do is to walk, especially if you're working. Try to walk on your breaks. Try to walk before and after work. It could be, you know, you taking a train station stop that's one stop further, just walking towards there and then jumping on the train from there. It could be 10 minutes before work, 10 minutes at lunch, 10 minutes after work. Okay, doing that 10 minutes before, 10 minutes during, and 10 minutes after accumulates to 30 minutes of walking. Say you're walking with an increased heart rate, and doing that 5 times a week accumulates to your 150 minutes actually. Okay, so can we get moving a little bit more? Again, it can come in many different forms of activity, but can we get that heart rate up? Can we get to this number? Okay, in whatever form that is. Okay, I want to talk about medication. So I need to stress this point. If you are experiencing any cardiovascular disease symptoms, such as chest pain, or weakness or numbness in the limbs, palpitations, breathlessness, headaches, lightheadedness, we urge you to see and book an appointment into your GP as soon as possible. Okay, we really do. So medical treatment will help with symptoms like your palpitations and arrhythmia and keep those symptoms under control. It can also help prevent and treat a heart condition. Okay, so examples of what that medical treatment looks like is statins. So that was in the news like 2 months ago, a month ago actually. Statins. So statins help lower your bad cholesterol, your low density lipoproteins they're called. You have ACE inhibitors, which manages your hypertension, your high blood pressure, and then you also have beta blockers, which manages abnormal heart rhythms. Okay, so that's just a few examples of how the medical treatment can be used to prevent and also treat a heart condition. Okay. Okay, so just to summarize everything we've gone through today, so have health checks where possible. Please have health checks where possible. Okay, consider some lifestyle changes. So if it's limiting the alcohol, having a review of how much units you have per week, avoid being sedentary. So we're getting up and moving when we can, and try cessation of smoking to stop smoking. Okay. Nutritional choices and methods of cooking. Yeah. So think back to those omega-3s that I mentioned, avocados, nuts, flaxseed, things like this. Can we have more foods of that? Can we try and get our 5 a day? And remember the cooking method. Okay. So can we try to grill that food? Can we try to bake or steam them vegetables as opposed to frying everything? Okay, because I do know a lot of people that just fry everything. Okay. Can we get more physical activity in? Is that home workouts? Is that exercising and going to the gym? Is that walking a lot more? Is it light exercise like gardening, tidying up, things like this? Can we just move a little bit more? If you are sitting down at work, can we stand? Okay. Can we just move a bit more? And last but not least, can we please, 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 if you are experiencing any symptoms, book an appointment to see the GP. Okay, like that group that I had the 2 days ago with the mental well-being and stress awareness, when I was telling them about the signs and symptoms of stress, and they said they all persevere. Don't persevere with this, please. Health is wealth. Okay, so book an appointment into the GP if you are experiencing those symptoms. Okay, so thank you for joining us today. We would love to get your feedback on this session. Okay, so if you can, we have a trust pilot. Would love to hear your feedback on here. Okay. All right. Thank you so much, guys.